Alright, this is your vertebrae. The first thing you want to do is determine if it's cervical, thoracic, or lumbar. And the best way to do that is to first count the number of foramen. So you count the number of holes. So in this one, there's only one foramen. You can see that there's only one hole in it. So this is not what you're looking for. This one has one, not what we're looking for. This one has one, not what we're looking for. So they only have one foramen. Now if they have three foramen, this one has one right there, two right there, three foramen. So it's cervical. So if it has three foramen, it's going to be cervical. One foramen, two, three, also cervical. One, two, three, also cervical. Since as we know those are cervical, we now have to determine, is it C1, atlas, C2, axis, or C3 through C7, which are all just your 5 typical vertebrae. First way to do it, let's look for C1. C1 looks like a shark's mouth right there. Because it has a shark's mouth, this is going to be C1. This is where the skull sits on top of the vertebrae and allows you to nod your head yes, or just allows you to nod your head yes. So this is your yes vertebrae, C1 atlas. Next one, between these two, you have to find C2. It's very obvious which one it is because it has this little tooth-like projection right here. This is called your dens. This is going to be anterior to the body, so this is going to be front of your body. This is C2, your axis. It's called axis because it has this little projection right there, which allows you to rotate your head about it. So this is going to be your no vertebrae. C2 is your no vertebrae. So again, it goes on top of each other, allows you to rotate. C1, C2, atlas, and axis. So then you have your typical vertebrae, C3 right here. It has its body, its spinous processes. The spinous process always points downwards, so that way you can tell superior from inferior. And again, it has the transverse foramina and the vertebral foramen. Talking about a typical cervical vertebrae, which is page 133, figure 10.12, typical vertebrae, it's actually going to be your thoracic. To look between thoracic and lumbar, this looks like a giraffe. You put it like this or like this. Kind of looks like a giraffe, so it's going to be your typical vertebrae, which is your thoracic. If you're looking at this one, the body is huge compared to all the other bodies, so you know that this is going to be your lumbar because it has all that weight to support. Another way to look at it is it looks like a rhino from the side, kind of, sort of. But we're going to go, anatomically speaking, we're going to talk about the different typical vertebrae spots. So this is a thoracic vertebrae, the giraffe. This is going to be your spinous process, which always points downwards. All right. Coming off on the side, you have your transverse processes. These transverse processes are where, like, you feel the outside, and whenever you bend forward, this pokes out and these poke out. You have the obvious body, or the vertebrae, and you have the vertebral foramen. This is where the spinal cord comes up through it. On the top, you have these two little facets, these smooth surfaces. These are going to be the superior articular processes, or the facet of the superior articular processes. This is where they lay on top of each other. On the side of each body, you have a little spot right there, spot right there, spot right there, and a spot right there. On either side, these are going to be your facets of the costal articular surfaces. This is where the ribs come around and attach to it, coming from the front side and around. And so this is going to be your typical thoracic vertebrae. And that is all you have to know, other than there's 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, and then 3 to 5 fused in the coccyx. That's it.